9 minutes after 9 o'clock, Free for All Friday. Good morning, I'm David Ayres, and we have got a cast of thousands for you this morning here on Free for All. A lot of great information to get out across Flagler County and surrounding areas. So many good things going on in this community. That's why we have our own reality check here. Morning, Brian.
Good morning, David.
Good to have you on. Brian, our editor of the local newspaper.
Happy to be here.
Palm Coast Observer. Also, Bob Snyder, one of our regulars here for almost a year now. He is the chief officer for our health department in Flagler County. Morning, Bob.
Hey, David. So glad to be here. Thank you.
And we've got Jerry Cameron, who's been around a while, our county administrator. Morning, Jerry.
Good morning.
And a guy who's new to town. Should we make them guess a little bit about who is our mystery guy? Yeah, we'll make them guess a little bit, okay? All right. But he can say good morning anyway.
Good morning. Thank you for having me.
Okay. Big news this week. Really great news. I mean, probably healthcare has never been in the spotlight more than it has been here with coronavirus and everything else. And where are we going from here and how do we do it? But our local hospital, Advent Health, of course, announced a 100-bed facility that is going to be built right in the middle of town. Brian, were you surprised to hear that?
Yeah, I mean, I knew that there was a purchase of property, so I kind of wondered, but I didn't really think it was going to be a full-fledged hospital, so that was a surprise to me.
Good. Okay. Well, me too. I thought it was just going to be like laboratory and, that kind of thing. But anyway, but let's just go right to the top here. Dr. Ron Jimenez, and good morning, Ron.
Good morning, David.
Was it a surprise to you?
No, not to me.
Ron's our CEO of Advent Health, and also we were just talking before the program with Bob that you're also an MD, a medical doctor, and now you're CEO, which is really into the business end of the hospital business. My question is, do you ever miss being OBGYN?
I actually do. It's actually really rewarding to take care of patients and bring little babies into the world. It's a fun thing.
I think maybe someday we'll do that here in Flagler.
We have to see how the demographics work out, but yeah, that's definitely an opportunity for us in the future.
So you're calling for more young women to Flagler County?
Many, many more.
All right. Well, we have a lot of questions. I know Brian does, and Jorge, our mystery guy, who I just let a secret out there on it, but we're all in the studio, and Bob, we all have some questions for you, but let me start it off and say why. And some people online, people are, oh, God, this is so great. And then somebody go, why do we need another hospital? So let's start off with, why do we need another hospital?
Yeah, we have actually been very constrained with regards to inpatient beds, operating rooms, you name it. We've been really struggling with handling the volume here in Flagler County. And so probably back in 18 is when we started the process of thinking about expansion and making plans, and so it's been a long time coming, really, really necessary in this county.
The COVID, has that had an effect on the timing of this or the design of this, that maybe pandemics are something that we need to get used to? I can't even believe I'm asking that.
Well, yeah, that's a great question because we started these plans before anything having to do with COVID, but when COVID came, it really underscored the need for that capacity because the future you may see something like this in the future. You've got viruses that can mutate and potentially reinfect, and so making sure you have capacity in your local health system is really important.
Brian?
Yeah, hey Ron. So the just down the road from the new location, Advent Health Palm Coast Parkway, which is going to be near Bridgehaven by between West Point Plaza and Market Street, from what I understand. Just down the road there at the light at US 1, you're going to look at another hospital, which would be by Flagler Health, I believe. We don't know a whole lot of details about that, but is there a point where there are too many? There's more competition, which seems good for the community as a whole. But where do you say, okay, now we have too many beds in the county?
Yeah, I don't really know what the plans are there with any of the other health systems. Heard a lot of rumors and things, but the fact of the matter is, if you look at the state of Florida, you typically have about 2.5 beds per 1,000 population. So there's plenty of room to grow with regard to inpatient beds, especially in our community that has a demographic that's a little bit older. So I don't think we're going to end up with too many beds.
So you need a lot of people to work at the hospital, a lot of nurses, but we're already short on nurses, from what I understand. So how do you staff that hospital?
Yeah, another good question. We're obviously going to depend on those institutions of higher learning that have already said they're going to be in our area. Daytona State is increasing their number of nursing students, as well as UNF and potentially others that are coming in and seeing that there's a great need and they could fill that need. So we're going to rely on all our partners. We also have Advent Health University that puts out a lot of healthcare professionals that we may have to leverage to help us get the staff for this facility.
Does Mednex, the announcement that, yes, it's going to happen, we're moving ahead, full speed ahead, did that have any weight in announcing when you did or if you did?
No, those were completely separate timelines. We were trying to announce this as soon as we had all our ducks in a row, and I would have wished it had been earlier, but timing is what it is, so it really didn't have any effect.
Orthopedics is a big topic, obviously, aging people and knees and joints and shoulders and all those kind of things, and hips and whatnot to it. I know Wally DeCino had mentioned that would be an emphasis with this new facility. Can you talk about that?
Yeah, you're right. We have a very unique county. So a demographic that's a little older, but they're very active and relatively healthy, which is great. But that does lead to wear and tear on joints, and so that will be an emphasis of this new facility. We're going to make sure that all our operating rooms are sized appropriately so that we can do orthopedic surgery in all of them. So that sometimes is a constraint you have. But yeah, we're making all our plans to make sure that we cover all those needs for the community.
The another big topic, of course, cancer treatment. Lots of people go to Mayo, they go to Moffitt, they go they go everywhere. Is there any plans for more of an uptick in cancer treatment for Flagler County?
So we've got really great cancer care here in this county. From medical oncology to radiation oncology. There's already great care here. I think a lot of the out-migration really has to do with perception and not really reality. But what we are doing is we're strengthening our ties back with our sister facility in Orlando that is a quaternary type of facility that does the full gamut. So anything we can't do here, we definitely can get done in Orlando within a short distance.
When you think about hospitals, you think about doctors and nurses, but it goes way beyond that with specialists and different jobs that would need to be filled. And like Brian said, it's very competitive. It's not just amongst our handful of healthcare facilities in this area. It's statewide and even nationally, where people are competing for for young people graduating from college with their skills and trades and things like that. I mean, that's got to be a big concern in filling the need with human beings.
Yeah, that's always an important part of the process, and we recruit nationwide. We get people from all over the United States. In fact, we recruit into Canada and like to go up there in the wintertime and show them pictures of the beaches. So we've got that is a big concern. We've got a very strong team working on that to make sure that we've got all the people necessary to get the work done.
And of course, then it goes into other sectors here. The impact of it that a lot of people I've heard. Actually, Michael Shimeno was in here yesterday doing Toby's show on Real Estate Matters on what a demand this is going to put on housing for Flagler County. And then housing, you got people paying taxes, and then that'll tie into our county here with Jerry Cameron. We'll be talking about later in the program on it. But are you also, you start hiring all these people, they got to have a place to live.
Yeah, it's part of the economic driver that healthcare is. It does create that economic tailwind for the rest of the county. and the real estate market is one thing, but I think as far as making sure we take care of the population, that's really the driving force behind what we're trying to do with the new facility.
Okay, and Bob Snyder, our Flagler County health officer, is here. So, Bob?
Thank you. Ron, good morning. So my question is, mental health and substance abuse services are the number one need here in Flagler County, and Volusia County as well. And, we appreciate the hospital and the foundation sponsoring a weekly radio show called Flagler Lifeline to raise awareness about mental health. I know it's primarily an outpatient kind of service, but anything more you can share about that in the future for us?
So we are looking at the potential around mental health and how we could, improve access to care. Access is very, very difficult in all of Florida, but here in addition. So, yeah, we are looking at how we could potentially partner with mental health providers, potentially look at some virtual care. There are several options, including, recruiting folks to come into the area and provide that care on an outpatient basis also.
Great. Thank you.
And so there'll be 2 emergency rooms in Flagler County, which I would think dramatically would reduce the length of time from heart attack in your living room to an emergency room. What right now the capacity for the emergency room that we have at Advent Health? Is it okay, or does it run hot, or are we going to have more emergency room service than we need?
Yeah, well, right now we're doing, prior to COVID, which is an interesting situation. With COVID, we actually decreased visits to the emergency room because I think folks were we're leery to come to the emergency room during a pandemic. So we're actually down 20% from where we were last year. But which was a pretty busy year. We saw about 45,000 folks in our emergency room, and so that's not terrible as far as outstripping our access abilities. But it's going to grow, and we have to have that additional capacity to handle the growth. So it will definitely help us have, especially during the winter months, that ability to stretch up to the capacity necessary to take care of all those patients with flu and all those patients that are here from the north. That is the time when it really gets stretched.
Ron, when you said our capacity was actually we're down 20%, Bob Snyder gave a groan like, boom. Why that reaction?
Because the biggest concern that we have among many is the people who are shying away from going to the emergency room for MI, stroke-like symptoms, and they're not receiving care because of their concerns about COVID. So, yeah, that's the reason for the big groan. And so I guess we need to do more education, and we need to convince everyone, do not hold back. Please, something serious is happening. Call 911 and go to the emergency room.
Brian?
Yeah, something else that comes to mind with 2 emergency rooms is this has a pretty dramatic impact, I would imagine, on the fire departments.
Yeah.
They have a very intricate system of where the ambulances are stationed and where things go. And with another one on the opposite corner of town, I wondered, I don't know if Jerry, you have something to say about this, or Ron, but do we know when did you start communicating with the fire departments to kind of figure that out? I know it's like at least a year away before this hospital would open, but it made me wonder.
To comment on that? I don't know. Nobody wants to.
Too early to worry about that yet, or?
Well, sure.
I think there are great discussions that need to happen, and I believe they would use criteria, distance criteria, and those sorts of things. But yeah, we want to make sure that that's completely and totally clear with our EMS and fire folks, because that's an important thing.
Okay, Bob Snyder. Then we're going to wrap it up.
Ron, you presented a rendering of the hospital for the public to see. I'm just curious about the timeline for this. I know it takes quite a while to plan and design and construct a hospital. And so are you into the schematic design phase yet, or do you think this is a 2-3 year long process? Sounds like you began planning already. So where are we?
So our timeline actually goes to the end of 22. We believe we'll be able to be very much close to being complete by the end of 22. Mm-hmm. The actual construction phase of this is only about 15 months.
Wow.
But there's so much prep and work that has to be done ahead of time, permitting, those sorts of things, that it ends up being a full 2 years just about.
Okay.
Well, I'm sure some people listening to this say, what? 15 months? How come it's taken 2 years and my house isn't done yet?
We're trying to leverage some new construction techniques, tilt wall construction and those sorts of things that are going to help speed the process up. So, yeah, it's amazing what they can do these days based upon the new technology.
All right, very good. Ron Jimenez, our CEO at Advent Health in Flagler County. Everybody really excited about having this new addition, which is all part of the big growth of what's happening here at exponential rates and everything. And so we appreciate you. Any final comments for Dr. Jimenez before we let him get on with his day? Yeah.
One quick thing. You mentioned the economic development factor here. That seems to be a major component. I mean, the announcement was 400 to 700 jobs, and these are pretty good paying jobs, So you think about, we don't get a company coming in or expanding very often. I don't know when the last time that happened, actually, of that magnitude, that would provide that many job opportunities. So that's a huge impact.
Yeah, we're happy to be able to do that. It's great for the county, not just on the healthcare side, but also on the economic side. So it's a blessing that we're able to do that.
Bob Snyder.
Ron, just a quick thank you. Wally and your team came through when we needed 100 doses of vaccinations, and we turned to our partners, your partner hospital in Daytona Beach. So thank you for arranging that. We were in a real pickle, and you came to our aid. Thank you.
Very happy to do that. Thank you, Bob.
Okay, lots of great things happening. Dr. Ron Jimenez, thank you so much. You have a super weekend.
All right, y'all do the same. Thank you.
All right, take care. We're going to take a break, and we will be back. Free for All Friday. I'm David Ayres. Way back there on the casting couch, Gretchen Smith. Also, we have a mystery guest. We let out his first name was Jorge. We'll leave it at that. Jerry Cameron. We got Brian McMillan and you and Bob Snyder, and we're going to be back finding out more about where are these vaccinations, how can you get them. We'll give you some inside information on that. And also, we're going to go out to the Emergency Operations Center with Jonathan Lord. So hang in there. We'll be back on Free for All Friday.
You don't think it'll happen to you twice. First, it was a fire. My agent was right there and helped me rebuild. Then the tornado destroyed everything, again. Both times, my independent agent and auto owners took care of me like someone takes care of family.
For whatever lies ahead, we're always there. Auto Owners Insurance.
In Flagler County, call the Haywood Brown Flagler Insurance Agency at 437-7767.
Hey everybody, it's Randy Dye from Maserati Alfa Romeo of Daytona. Our Start Something New Signature Certified Pre-Owned Sales event is going on right now. How about no payments until spring 2021 with rates as low as 1.89%. Highest quality pre-owned signature certified vehicles in the region. Shop online with Easy Purchase 24/7 from the comfort of your own home. Quality vehicles with a quality staff. Come see us at Maserati Alfa Romeo of Daytona and get a signature certified pre-owned vehicle with my signature on it.
I probably shouldn't be saying this, but your neighbor came in the other day, and he's got money under his mattress. That Smarter Smart Bed is the way to go. It adjusts to what you want, from rock hard to cuddly soft, and it doesn't cost a fortune. Never pay retail. Put your money under your mattress. Stop in and try the Smarter Smart Bed. The beds are smarter than we are. You know who we are. We're Bed Tops Mattress Clearance Center in Palm Coast. Call us anytime. 386-627-4188. Bed Tops Mattress Clearance Center.
9:29 Free for All Friday. And a good news day today. And Bob, I know you, Gretchen, came in here from giving a speech somewhere.
Yeah, come on, Gretchen.
All right.
I was actually visiting with some of my old colleagues. It's the Friday Leads group that actually started back in the chamber. Oh my gosh, how many years ago? So yeah, they invited me to come.
Was it a good speech?
It was good. I just talked to them about what's happening with COVID and answered a lot of questions about vaccines and probably what Bob's going to be talking about right here. And masks, the importance of masks still.
Okay, we are going to get to that and where you can, the secret locations to get your COVID vaccination. Okay.
Don't do that.
No, really, do not go to a secret location to get a vaccine.
All right, well, it's called a tease. Right, Brian? You've gotten pretty good at those.
Is there some dark alley where you can get a COVID vaccination?
There is. All right, we'll give out Gretchen's home address here in a little bit. Let's go over to the Emergency Operations Center, where our fearless leader of all different kinds of, we're always at war, whether it be fires, whether it be hurricanes, whether it be flooding, whether it be insects, whatever it is. Who do we call on?
Jonathan Lord.
Jonathan Lord.
we don't want him to get bored over there.
No, it's what.
Gee, thanks, Brian. I appreciate that.
All right, Jonathan. By the way, if you just tuned in, Free for All Friday, I'm David Ayres. We got Bob Snyder, Gretchen Smith. We've got our mystery guy, Jorge, who's a guest today of Jerry Cameron, our county administrator. We've got Brian McMillan. And we've got Jonathan Lord, our Director of Emergency Management.
By the way, David, Jonathan is getting PTSD therapy now.
We all are.
Well, good. That's all right. We can take care of any of your problems here in Flagler County. All right. Well, first of all, Jonathan, I know you're working with Bob in the health department on distribution and things. So you want to kind of give us a quick overview of the distribution right now, because it's about testing, which we're still doing, and also distribution of the vaccine, if we had some. So go ahead, between you guys and the health department, take it away.
Yeah, so it's good morning, everybody, and it's our testing and the vaccination process. Is very much being led by Bob's team and through the Florida Department of Health out of their Flagler County office. But we are doing everything possible to support them and help them be successful and make the process as smooth as possible. And I'm not saying there aren't any speed bumps, but as smooth as possible for everyone to get vaccines and tested when necessary. Our big focus in partnership with the health department really is the vaccines right now, but testing is still happening on most weekdays. But the big thing we know with the vaccines is appointments, and the biggest issue we're all having is we have tens of thousands of Flagler County residents qualified, eligible, and willing to receive the vaccine, but we only get hundreds of doses each week. And even last week, we actually had 0 doses, unfortunately. But we're expecting hundreds of doses each week moving forward as long as the vaccine supply stays stable. But it's going to take us many, 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 many months if that number of doses does not increase before we can get to the tens of thousands of Flagler County residents looking to get vaccines. So we are trying our best. We're managing an appointment system on behalf of the state for the time being. Fingers crossed. The state has told us they are rolling out a statewide appointment system that we will obviously be a part of. That's one of the requirements with the state. However, that does not exist yet. And that's just what happened is, the vaccines arrived. They were not ready with an appointment system, but it does not make sense to hold on to vaccine while you're trying to figure things out like an appointment system. So local governments here, like our county government, we got involved in the appointment business to help the state out so we can get vaccines into people's arms.
Hey, Jonathan, why don't we let people know, please? I know there's hundreds on the callback list, and those who accessed county emergency management through the online system, but just remind listeners, those who want to get vaccinated over the age of 65 or healthcare workers, what do they need to do to get an appointment?
So we offer 2 options. One is the get on our callback list option. So you can call anytime Monday through Friday between 9 a.m. and 4 p.m. You can call 386-313-4200, and we have a call center set up, and we will add you to the waiting list. And that waiting list, as of yesterday evening, was well over 9,000. And by the end of today, I would assume it's probably going to be close to 10,000.
All right. Okay. Well, let's talk about the waiting list. All right. Sure. Because to me, I have no interest in being on a waiting list of 9,000, people and feeling like, okay, it's almost like, at Disney, thinking you're almost getting ready to get on the ride. And then you turn the corner, and there's all these cattle chutes with thousands of other people in front of you still.
There's one real complication to that waiting list situation, and that is that if you watch the news at night, you see politicians saying we're sending 1 million here, we're sending 1 million there. You get pictures of airplanes being stuffed with vaccine, and the public is sitting there watching that at night, and they say, well, I'm calling up and getting mine, and then we tell them there is no vaccine, that we've got a few hundred that have come in, and worse than that, we can't tell them when we'll get the vaccine.
Right.
And it's very frustrating to the public to watch that on the news and then hear local folks tell them that there is no vaccine.
Yeah, and I know you guys are put in a rough situation, but Jerry's right. I mean, this is where, it shows the factory at Pfizer, stamping them out by the millions and boxed up and being shipped out and everything. Makes me wonder, is there politics involved where, hey, if you're not down in Miami, you ain't going to be getting them if you're here in Flagler?
No, that couldn't possibly happen.
In all fairness, actually, I did a very down and dirty comparison of the number of vaccines residents of certain counties received, and I just only had a few seconds to look at it quickly this morning. So I looked at Miami-Dade County, the most populous county, and that's the one we just joked about a little bit. We have, not by much, but we have vaccinated a higher percentage of our population than Miami-Dade County has. So it really is, nobody has access to a significant quantity of vaccines. And David, as you said, you see the news clip on TV where it shows the factory, but that factory is shipping across the entire world. And that's the part that maybe sometimes that news clip doesn't quite purvey, is you may see a factory with millions of doses spinning off of some fancy-looking machine, but those millions of doses are getting divided around every single country in the globe.
And, just on a real positive note here, truly, I mean, the health department team and our wonderful group of volunteers, we've been at the fairgrounds now, our primary mass vaccination site, drive-through site, and it takes 40 people to be on one team. And so far, we've distributed 2,330 doses. So we proved to ourselves, now being out there for 10 days, that we can do 1,000 doses a day, that we've really worked on the efficiency factor here. And so we can get that vaccine into arms rather quickly. So all we need is the supply, just as we've been talking about. So I just want to assure everyone that we got it together as a health department, with emergency management, with our volunteers through Flagler Volunteer Services, and we just have it going on. So we are ready, willing, and able.
Kind of equate it to, all right, the call has been made to our health department and the county and the volunteers, the community have all come together. Let's get up to the front line and let's win this battle. And they're all up there in position, and they go, okay, where's the ammo? And you're going, we don't have any, but we got our troops in place.
Yeah.
Well, and if we could get the product, we could literally provide vaccinations to every person in Flagler County that wanted them in 60 to 90 days.
That is correct, because we're putting together a plan, and the plan is almost completed, and that is to have 4 complete vaccination teams of 40 people each between staff and volunteers, and we have about 3.5 teams already coordinated. So yeah, we got, and if you want to be a volunteer, FlaglerVolunteerServices.org. We're going to work through Judy and Susie Gamblain and their team to get all the help that we need. Now, regarding second doses, and this is good news, every single Friday, so today we expect our very first shipment of second doses for those eligible for second doses next week. And then that'll happen every single Friday. So coming down the road here, Mondays are going to be known as Second Dose Mondays. We're going to crank it out morning and afternoon all the way through on Mondays to get those second doses in for individuals ready that week to go.
Gretchen?
And let's clarify, actually, that this week, the doses that we get today, the second doses, those are going to be for people who got their first doses up to January 19th or January 14th. So that's 1,700.
Okay.
That's over 1,700 people.
All right, let's talk first, second dose. All right, because you get your first dose. Well, some people did. Some of the privileged did. Congratulations. Glad you got them. And then you're supposed to get your second dose within
28 days.
Within, say, a month. Okay. All right. So do they get the priority? Is it the exact same? Dr. Bickle, are you with us? Oh, Dr. Bickle. Paging Dr. Bickle.
Yes, I'm here. I was muted, sorry. I was trying to keep the radio from blasting. I'm in the car.
Okay. Is the second dose exactly the same concoction as the first dose, or is there a difference in them?
Absolutely the same.
Okay. So so now we have people that have no dose, and I heard you on this week saying that even with your first dose, there is quite a bit of protection, correct? And the second dose
about 2 weeks.
After 2 weeks, okay, and then the second dose is kind of a booster sort of a thing. So are we better off with limited supply if there's quite a bit of protection with the first one? Why don't we just get more people get their first ones before worrying about the second one?
Yeah, there's been a whole bunch of debate on this, and it's an interesting debate. I think England actually is kind of postponing the second dose for that reason. There's about as many people on one side as the other, maybe kind of more on the side of sticking with the 2-dose. We've gone through a lot of effort to try to build the credibility behind this vaccine, that it's, we didn't take any shortcuts, it's safe, it's effective. To just kind of, based on some really small amount of data, it's quite dramatic, the protection after 1 dose, but it's really way smaller group of people and days of follow-up than the original studies that validated the 2-dose regimen. So it's kind of jumping to some conclusions. It might give a message to people they don't need the second dose. The fact of the matter is, booster second doses do a lot for the immune system that the first dose doesn't. There's several things that go on that are pretty profound with that booster dose. That's why it's used so often. The immune system matures in its response to the virus, which is very important for long-term protection. So, I just heard an hour debate on this earlier in the week, and some real experts talking about the nuances of it, and they were leaning to just sticking with what we've got and getting as much vaccine out as possible. That's the bottom line, is getting lots of vaccine available, because really you're only getting a few extra weeks by skipping the second dose, a few extra weeks of people vaccinated. So, and it's also the other issue of just the logistics, telling people one thing, then changing it, and back and forth. So the most persuasive thing I've heard is just stick with the current regimen and just do all we can to get vaccines as many people as possible and off shelves and out of refrigerators and things like that.
Bob Snyder.
I just want to assure the public, Jonathan and I in particular, we get to listen in on several conference calls to stay updated that involves all the emergency managers and health officers in the state. And we're assured that these second doses are priority in the state of Florida. That's why we're going to get a special shipment every Friday. So I don't want people to be concerned about not being able to get that second dose. They're going to get called ahead of time by Jonathan's team to remind them and to notify them that second doses are here and that they're scheduled for that second dose Monday. So all that is being arranged.
Brian?
We keep hearing about new strains, twice as contagious. 20 states now have it. Are you concerned about that, Dr. Bickle, and does the vaccine handle that one as well?
Well, it's going to be an evolving story. I mean, these things take on a certain life of their own, and we went to not really worried about strains, and it's actually called variants. Strains is a bigger change in the virus, but the thing is, there's a couple things going on. One is we haven't been doing a lot of testing for the strains. You have to do this genomic testing where you map out the genes. So we haven't been doing it, so it could have been there and not noticed, and it almost certainly was there. Secondly, we've got way more virus out in the world these days. Just way more. So the mutations are a function of how much virus is there. It's just kind of a math, and so it's kind of expected that there'll be more variants coming down the pike. They may affect natural immunity, like people who've been exposed to actually had the infection, and then they look at their antibodies. Vaccine-induced immunity is different and probably stronger and more robust. So whether it affects, and they've done some engineering of the spike protein, which is where a lot of these mutations and variants are coming from. So so far it's looking okay. There's more concern about the South African variant than the UK variant for the vaccine. They haven't tested it, to my knowledge. They have tested the UK variant, and the vaccine appears to be effective. It's very much up in the air right now. But the bottom line is that the key points with these variants are there's a selection process to make them more contagious, not necessarily to make them more deadly, but the more contagious they are, the more people are infected, and they could cause more deaths because there's more people infected. And the second thing is there is a selection pressure to make them resistant to the antibodies because then they survive better. That's going to be an evolving story. So the key point is for as many people to get vaccinated as possible, and of course lots of people want to get vaccinated. Our job is to get them vaccinated. And the second thing is to be super vigilant with social distancing and all the measures that work for all the viruses, because there's no mutant that escapes a mask or social distancing. That's kind of a different phenomenon. But so it's going to be an evolving story. It's probably going to be going on for months, trying to sort out which of these are, resistant, which aren't. They have ways of doing it. They can test them in the labs to the antibodies themselves that people have created. They can test them to the vaccine antibodies. So there's a lot of science. The whole drama here may start getting more interesting and intense in terms of the science of the virus as this phenomenon goes on with the mutants.
All right. Dr. Bickle, we got to move on. And any final words from you?
No, just, Bob Snyder's ready to get, vaccine in anybody's arm that they're really good at getting it out. So people just be vigilant and, we're going to get over this.
All right. Very good. You have a safe weekend, Dr. Bickle, and we'll talk to you next week. Thanks.
All right. Thank you.
Okay. Hey, Jonathan, before we let you go, I see Press Release Emergency Management Director Jonathan Lord appointed to the state's Domestic Security Oversight Council. What the heck is that all about?
It's just a really cool sounding group. Not just kidding.
I'm impressed, man.
I want to become like the federal government positions where they have like really long titles after their names. I've always wanted that.
Well, when I hear domestic security, I think terrorism and nasty people. Am I on track or off track?
You are right on track. So it is very much another term for terrorism, and though domestic security focuses more on terrorism in the homeland. So in the state of Florida, domestic security is headed and overseen and coordinated by the Florida Department of Law Enforcement, and they actually have a chief of domestic security. That's one of their high-ranking positions within that state agency. But that chief is advised by a group of about 20 different individuals on a state council. Those individuals are all appointed by different entities to serve on that council and represent various groups or organizations that have a role in domestic security, and emergency management is one of those roles. And when this committee was formed after 9/11, or this council was formed after 9/11, the Florida Emergency Preparedness Association, which is the statewide association that represents emergency managers at all levels within Florida, including the private sector, controls one of those seats and can appoint somebody to one of those seats. My predecessor was there for many, many years. At least 5 years, if not a decade. He retired. He was actually the emergency services director in Putnam County for a long, long time. He retired this past year, and that position was open, and I was asked if I would serve in that role. And part of that is because I've been involved in domestic security things since moving to Florida in late 2003, 2004, and starting my emergency management career in South Florida. I've been very involved in Homeland Security type items, so they asked if I would want one more, feather in my cap, and if I would serve in that role. And my boss said it was okay for me to go ahead and serve and help the association, and that was where the association asked if I would be.
So do you get privy information to like terrorist threats and things, for particularly for Flagler County? If we know some bad guy is moving to the area or is doing something, does that give us a little bit of a leg up on intelligence?
Not inherently. I'm trying to answer this the right way. Not inherently. Again, that's really the realm of law enforcement, and my role for representing the emergency management community, and obviously it benefits Flagler because Flagler always comes first in my mind. representing the emergency management community is really more the consequences of terrorism. It doesn't mean that all of a sudden I'm involved in law enforcement side of Homeland Security. That truly is a sheriff's office and FDLE and the FBI. But emergency management has to deal with the consequences or the impacts of terrorism and work with those agencies that are involved in the law enforcement side to be prepared for potential impacts of terrorism. So it will focus more on steering general policy around the state, and the part that means the most to local governments is this group also approves funding plans for Homeland Security funds that come down from the federal government. This group approves funding plans for the millions of dollars of those funding streams that then eventually go to the legislature for final approval.
Okay. Well, we're going to give you a test here right now on just how up you are on domestic intelligence in Flagler County. We said we have a mystery guest in the studio this morning. Can you tell us who it is?
A mystery guest.
Jerry Cameron brought him in.
Is it the county's new chief of staff?
Dun, 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 dun.
You're right.
The bell.
You win a
That's where I win.
You win a free Super Wash Express. Okay.
Yay!
All right. We're going to be back. We'll be back with Jorge Salinas on Free for All Friday.
Everyone's watching to see what you do. Everyone's looking at you.
Attention shoppers, our garden shop will be closing.
Excuse me, sir. You waiting to use the bathroom?
No, I'm waiting for somebody to do my taxes.
Somebody in the bathroom doing your taxes?
No, can't you see that Jackson Huey Dewey tax sign right there?
Jackson Huey Dewey is conveniently located next to the bathroom.
Why don't you just make it easy and go to Flagler Tax Service?
Flagler Tax Service. Call 793-7156.
So you're ready to list it? We're ready to sell it. This is Sam Perkovich, broker-owner of Parkside Realty Group. Stop by our office in Town Center or call us at 302-0300. Visit us online at parksiderealtygroup.net.
I probably shouldn't be saying this, but your neighbor came in the other day, and he's got money under his mattress. That Smarter Smart Bed is the way to go. It adjusts to what you want, from rock hard to cuddly soft, and it doesn't cost a fortune. Never pay retail. Put your money under your mattress. Stop in and try the Smarter Smart Bed. The beds are smarter than we are. You know who we are. We're Bed Tops Mattress Clearance Center in Palm Coast. Call us anytime. 386-627-4188. Bed Tops Mattress Clearance Center.
9:52, Free for All Friday. I'm David Ayres. We got Bob Snyder, Gretchen Smith. We have got Jerry Cameron, our county administrator, Brian McMillan, editor, Palm Coast Observer, and announced by our Homeland Intelligence guy right here, Jonathan Lord. And so welcome, Jorge Salinas. Good to have you on board, and our new chief of staff in Flagler County.
Thank you for having me, Dave.
You can get a little close to that microphone there. We've sterilized it for you.
Yeah, thank you for having me, Dave.
Good to have you. The chief of staff can you describe what the position, what it means, and what you would do all day?
Chief of staff for me, it's similar to what I was doing in terms of deputy city manager in the city of Albany. We'll be able to help work with the different departments and deliver the services that the community needs, and also back up the county administrator when he's not available to work with the county.
Okay, so Jerry, with Jorge joining us here, is chief of staff a new position, a new title?
It's a new title for Flagler. It's actually a more correct title. Ultimately, as your organization structure evolves, you generally have a chief of staff who handles all of the staff issues and so forth, and then you have a chief of operations that runs the daily operations of things. Very similar to a private sector where you have a CEO and a COO and a chief of staff.
So as county administrator, here's a lieutenant basically trying to put into perspective, like, okay, hey, here, Jorge, go along. I'm going to throw you the ball and run it in.
Well, it's actually more than that. If you do this right and you get the right person and you do the right training and preparation, if I got run over by a logging truck, the county would be very little affected because he could switch immediately
we would
to
be
do my job, and he would have people that were trained to be able to step up and do his job. So.
Okay. So just tell us a little about you, Jorge. Well, you said Albany. Where are you from, and what's a little background?
Yeah, I'm originally from Puerto Rico, and my wife and I and our kids moved to Oregon 23 years ago. So one of the decisions for us to move there was to raise our kids. My oldest son, he's 30 and he's in the Air Force, and my daughter, she's studying in Penn State right now. So we accomplished that goal that we were set ourselves to, and we've been down to Florida many times in the last 2 years. I say many times, probably 4 or 5 times. And we decided that instead of waiting to come down later on when we retired, we decided to look for opportunities to do it earlier. And I'm grateful for the opportunity Mr. Cameron and the Flagler County has provided us to be able to do that in a faster pace.
And he is absolutely committed to the county. He's been here a very short period of time, but he leaves here today to go and close on a house that he just bought. So he's all in.
Good. Great. So he's all in. I like that. How old are your kids?
My son is 30 and my daughter is 26.
They're going to move here too?
No. Maybe later. I don't know later on. But my son is in the Air Force, so he's out in Nevada. We have our 16-year-old Chihuahua living with us, 4 pound.
All right. So what is it? Because you looked at a lot of different things before saying, okay, let's go interview with Flagler County. And what was it about Flagler County as opposed to other opportunities?
We were looking for an area that is not too densely populated. That's one of the things we were looking for. And this seems to be the right spot where it provides an opportunity with a lot of natural resources and beautiful beaches. But also it's close to areas like, Orlando or Jacksonville that you can actually go and do other things there.
Okay. Bob Snyder?
Jorge, so we understand you're in boot camp. So what is boot camp like?
It is what I call Mr. Cameron's boot camp, and it's actually a non-traditional, comprehensive, fast-track immersion and onboarding process that Mr. Cameron has designed for me. That takes perhaps something that would take 9 months to 12 months to come up to speed. He's trying to accomplish that with me within a 2-month period. So hopefully I'll be able to survive that boot camp.
Do you have to do 100 sit-ups and 100 push-ups every day? And is lunch like within 10 minutes?
It feels like that. Actually, lunch is within 10 minutes. Everything is going so fast that we have to eat and continue to move on with the different activities.
The great thing about this is that Jorge really brings some skill sets that I don't have. He has done a lot with Six Sigma. Is used extensively in the private sector for quality control, but it's relatively rare in the public sector. He's done some great things, and he's really heavy into digital transparency. He has set up systems where the public can actually go in and in real time monitor our electrical usage in the government, what we're doing in various areas. Really good at strategic planning, and that's the subject of another show because we're about to launch strategic planning in Flagler County. And that's going to be a real boon to the community and the ability of the commission to plan.
I know, Jerry, last time you were on, I said, well, with COVID and all these different kinds of things, and where are we at financially? Are we top heavy in debt? And you said, yeah.
Well, yeah. That didn't change. We're doing some financial progress, and we've gotten our reserves back to where we need to be. I'd like to get my debt ratios a little bit better than we've got them. But the strategic plan is going to show us that in graphical form that where we are with all of these things. That's why I say this is good for a future show, because we're going to be launching that planning. At present, our commission's ability to budget is kind of like, okay, we're going to have this much money. How would you like to spend it? And it doesn't take into consideration of what obligations and challenges you're going to have coming up in future years, what your debt ratio is, how your economic stability looks. Can you withstand? Are you resilient enough to stand an unexpected economic event? So those are the things we're going to get into, so that our commissioners will have better information to make decisions in terms of the long-term viability of the county.
Okay. Or hey, what anything in particular? Like, I'm sure you're kind of prioritizing. Like, all right, here I am. I got this, and learning all boot camp. And as soon as your drill sergeant leaves you alone, and you get to actually do your job. What's your top priorities? What do you see Jorge taking on?
I think the top priority would be to continue to build those relationships that will be needed in order to help resolve the issues that will come up to me. We have to describe in a few words, I've met with so many people thus far, but we have an incredible pool of talented and committed employees that we don't see. And I would like to take some of that work that they're doing, good work that they're doing, and try to expose it to the community, so we can actually put some metrics and put some hard numbers of what they're doing, because right now they're just working very hard, and sometimes we don't see the products and value they're providing to the community.
Okay. Yeah. Is that government and business? I always kind of look at kind of compare the two, and sometimes they work, sometimes they don't together on it. But do you have more of a governmental mindset in management, or a business background?
I would say it's before I joined government, I did not want to work for government. It was just a stepping stone, because we had to move. My HP was moving us to Austin, so I wanted to do it just for a year or two and go back into the private sector. The change in mind for me was that working in the private sector, we worked on different projects, development projects, and we never saw the customer. We were always in the back, and behind the scenes. This working in government has provided me an opportunity to see how we benefit and provide value to our residents that are investors. So that keeps us in that mindset. But in terms of management, I think I would draw from both perspectives. There is a benefit of using both approaches and combining those and trying to use the best approach when it's needed, but basically using both, my experience in the private sector and the public sector.
Jerry?
Well, we make a lot out of the boot camp on the funny side, but there's a real practical side of this. When you consider that just taking a law enforcement officer, that we require him to go into field training for weeks and weeks before we allow him to go out on the road. But you're bringing in the second in command of a county that's rapidly growing, and the typical approach is you bring him in, you walk him around, shake hands with everybody for a day, and then we throw him in the deep end of the pool. And that's not what we want to do here. We want to make sure that he understands the character of this county. He understands the perceptions that people have, the passions and the needs that the community has. He understands the players. He understands the commissioners and what they're looking for. And then you say, okay, Jorge, you've got the information. Go get them.
Mm-hmm. Jerry, our Cameron, obviously, this isn't your new 20-year career, and you're, kind of thinking, when do you get the off-ramp and go back to retiring or whatever you're doing on it? So what is your timeline?
Well, what I would like to do is finish up what I committed to do. There are a number of projects and problems that were out there, But, to complete the staff development that I started, we ought to have a succession plan in the county that's a couple layers deep. And I want to get that in place. But now that I have Jorge, and I'm totally convinced that he is going to be able to take this and run with it, it's going to shorten my timeline. I'd like to be, by midsummer sitting on my porch trying to figure out what it all means.
Sitting on your porch. All right. Well, there's the beginning of the picture. What would be in your hand?
Right hand, left hand,
either
cocktail.
Depends
maybe.
on the time of day.
Yeah.
Either a Balvenie 21 Portwood finished, or perhaps a Booker's. One of those things.
I can tell you put a lot of thought into that. Okay.
Well, yeah, in this job, sometimes lithotherapy is absolutely necessary.
Well, Jorge, welcome to Flagler County. So happy to have you and look forward to working with you here. I know Brian is, and all the media. We're here to get the word out as soon as you have something to say. So keep in touch with all that, okay? We'll have you as a regular guest on here.
Thank you. I'm very grateful.
And hope you survive boot camp, because you can get kicked out of boot camp, right?
I know, yeah. It can happen.
So you're, yeah.
So it's a weeding out process, isn't it?
That's right.
He went through a very intense selection process. He said he had never even seen a selection process like that. And now he's in an intense orientation process. So he's been a great guinea pig so far.
All I can say is I wouldn't want to be the only recruit in the troop.
What have I done?
Yeah. It's hard to be the only recruit. All eyes on you.
That's great. We gotta wrap it up here today with some final words of wisdom here. Brian McMillan.
Welcome to town, Jorge. It's good to meet you. And just wanted to remember that we got these spiking cases, and let's keep washing those hands. I keep going around to stores, and you see a lot of noses poking out of masks, and some people just not wearing masks, and it's just, we got to do our part. So, but have a great weekend.
Very good. Bob Snyder, Gretchen, Health Department, final words?
Yeah, just want to echo Brian's comments. Even people who have been vaccinated, you'll be safe, but you still can be a carrier of the virus, because the virus loves our nasal passages. So covering your face with the mask, especially your nose, is great continued public health advice. Please do it.
Gretchen Smith.
All right, and testing next week. We're going to be testing 4 days a week, Monday through Thursday, from 1:30 to 3 o'clock across from 120 Airport Road, and Friday morning from 9 to 10:30 at St. Elizabeth and Seton. So if you need to get tested, come out, and it's free. And at PCR, we're averaging about 2 days turnaround for testing.
Okay.
So otherwise, be safe.
And our County Administrator, Jerry Cameron.
Since it's been a health program, I'd like to follow up on Brian and Bob. There is a benefit to this COVID, and that is that with all of the mask wearing, the hand washing, the social distancing, the hand sanitizer, there are almost no colds this year. We don't have people out due to colds and flu.
That's correct, sir.
All right, good positive. And, of course, our guest of honor, Jorge Salinas, final words to you from the people of Flagler County.
Thank you for the opportunity to allow me to serve you, and I look forward to providing value and working with many of you closely. Thank you.
Very good. I like how he said he looks at us as the investors in Flagler County, and you think about it, we are. We're all in it together here. Jorge, have a great weekend. Jerry, thank you. Brian, Gretchen, Bob, Dr. Bickle, also Ron Jimenez, and our new Domestic Security Oversight Council member, Jonathan Lord. Be safe. Have fun.
Serving Flagler
County for over a decade. WNZF, 1550 AM, 94.9 FM, and W235 CW Bunnell.